Isolated REM sleep behavior disorder is by far considered the strongest biomarker of an early alpha-synucleinopathy, so even consider the early stage of alpha-synucleinopathies. This means Parkinson's disease, dementia with Lewy bodies, and multiple system atrophy. And what research is doing at the moment is trying to find biomarkers which can allow to understand which patients with the isolated REM sleep behavior disorder will become a full-blown Parkinson's disease, for example, and especially when this will happen, because this is the main question we have to answer. We know by now that isolated REM sleep behavior disorder is an early stage, but we do not know when this will become full-blown disease. Therefore, there is a lot of research at the moment in order to understand to identify new biomarkers, essentially, of this conversion. And EEG, so brain waves, have been investigated as possible biomarker. And the investigations have been done both in sleep EEG, but also in resting state EEG. And in both fields, resting state and sleep, we see new developments of artificial intelligence. For example, from resting state EEG, a deep learning algorithm has been shown to be able to really identify isolated RBD patients, which then converted to dementia with Lewy bodies or to Parkinson's disease. And it has been shown, and this is interesting, that these deep learning approaches, so kind of consider black boxes, at the end reveal same biomarkers of other classical analysis done on EEG. At the same time, personally I've been working on an algorithm, artificial intelligence algorithm, to identify the conversion from a new state, which is called prodromal RBD, to full-blown RBD. So even before RBD, there is this stage of evolution of RBD, which is called prodromal RBD. And also here we have seen that in patients with already Parkinson's disease, there is artificial intelligence can really help to see this evolution. So both classical analysis, but even more artificial intelligence-based analysis applied to iRBD patients allow to understand better the disease, and possibly being non-invasive and also not so expensive could help to understand the disease development and to identify the iRBD patients which then convert. And this will help in order to make in the future clinical trials which can test new neuroprotective treatments for these patients.